So today we will discuss about corpulmonale. Corpulmonale is the condition which we study in both the respiratory system as well as the cardiovascular system. What happens in the corpulmonale? In the corpulmonale there is the right ventricular hypertrophy. It occurs because of the long-term high blood pressure in the arteries of the lungs as well as the right ventricle. So these conditions may cause the right ventricular hypertrophy that may lead to the right ventricular failure. So this condition is known as corpulmonale. So corpulmonale is the failure of the right side of the heart. Okay, then it is brought on by the long term high blood pressure in the arteries of the lung and the right ventricle of the heart, as I have already told you. Then it is a condition in which right ventricle of the heart enlarges as a result of diseases that affect the structure and function of lung and its vasculature. जो diseases हैं जो lung को affect कर रही हैं, lung के structure और function को affect कर रही है, जिसकी वजह से further then right ventricle में जो pressure बढ़ रहा है, जिसकी वजह से the right side of the right ventricle is enlarging. That condition is known as corpulmonale. Any disease affecting the lungs and which is accompanied by hypoxemia will lead to the corpulmonale. So the definition is corpulmonale or right-sided heart failure is the enlargement of the right ventricle due to the high pressure in the lungs and usually caused by the chronic lung disease. So in this, actually what is happening, the right ventricle failure is occurring because of a disease which has occurred inside the lung. That may usually that is chronic lung disease. Of any disease in the lung which causes the high blood pressure in the lung, that lead to corpulmonale. Okay, then causes COPD, as जैसे हमने already discuss कर दिया कि these are the lung diseases which are affecting. So COPD may be a disease condition. Then conditions that restrict or compromise the ventricular function leading to the hypoxemia. कोई भी ऐसे diseases जिसकी वजह से left ventricular जो ventricular function है वो affect हुए हैं, जिसकी वजह से क्या हो रहा है, जो hypoxemia is occurring. वो क्या हो सकता है, वो रिस्ट्रिक्शन में वो कंडीशंस, डिफॉर्मिटी इन द थोरेसिक केज, ठीक है, वो अच्छे जो थोरेसिक केज है वो अच्छे से फॉर्म नहीं है, जिसकी वजह से द ऑक्सीजनेशन ऑफ ब्लड इज़ नॉट अकरिंग. ठीक है. दैन क्रोनिक ब्लड क्लॉट्स इन द लंग्स, ठीक है, थ्रोम्बस हैं तो उसकी वजह से भी सर्कुलेशन ऑब्स्ट्रक्ट होती है और ऑक्सीजनेशन ऑब्स्ट्रक्ट होएगी. देन कंडीशन दैट रिड्यूस द pulmonary vascular bed, that is pulmonary embolism, pulmonary emboli है या फिर कोई और रीज़न है जिसकी वजह से pulmonary hypertension हो रहे हैं. Because of all this the pulmonary vascular bed will be reduced and this will lead to the corpulmonale. Then certain disorders of nervous system that are affecting the respiratory muscles and chest walls as well as the pulmonary artery. Pathophysiology, because of the emphysema. What is emphysema? It is a condition in which alveolar sacs are damaged. ठीक है. So because of emphysema or the pulmonary emboli, there is the pulmonary arterial vasoconstriction and reduction in the pulmonary vascular bed. क्या होगा, because of this pulmonary emboli and emphysema there will be vasoconstriction of the pulmonary arteries and which will lead to the reduction in the pulmonary vascular bed, and this will increase the vascular resistance. ठीक है, कंस्ट्रिक्शन होगी तो रेजिस्टेंस बढ़ेगी, दैट विल लीड टू द हाइपोक्सीमिया क्योंकि जो सर्कुलेशन है वो अफेक्ट हो जाएगी एंड दैट्स वाई हाइपोक्सीमिया एंड हाइपरकैप्निया विल बी अकरिंग. हाइपोक्सीमिया क्या होता है, जब ऑक्सीजन का जो कंसनट्रेशन है वो वॉल्यूम का कंसनट्रेशन कम हो जाता है, ठीक है। अगर ऑक्सीजन कम होगा इसका और गैस एक्सचेंज प्रॉपर नहीं है बिकॉज ऑफ एल्वुलाइज आर अफेक्टेड, ठीक है, एल्वुलर सैक्स आर अफेक्टेड, और ऑक्सीजन जो ब्लड में जाना चाहिए वो भी नहीं जा पा रहा, हाइपोक्सीमिया हो रहा है, एंड द कार्बन डाइऑक्साइड विच हैज़ टू कम आउट इन द एल्वुलाई वो भी नहीं हो रहा, तो हाइपर कैपनिया जो कंसनट्रेशन ऑफ कार्बन डाइऑक्साइड है दैट इज मोर इन द blood. So this is the impaired gas exchange, and there will be increased resistance in the pulmonary circulation. जो pulmonary circulation है वो properly नहीं होएगी, pulmonary circulation properly नहीं होगी तो there will be rise in the pulmonary blood pressure, that is known as pulmonary hypertension, and this will cause the increased workload on the right ventricle टू पम्प द ब्लड अगेंस्ट द हाई प्रेशर, ठीक है। जो पल्मनरी कंजेशन हो गया है, ब्लड फ्लो ऑब्स्ट्रक्ट हो गया है, उसकी वजह से पल्मनरी हाइपरटेंशन हो गया है। अगर पल्मनरी सिस्टम में अगर पल्मनरी रेजिस्टेंस ज़्यादा होएगी तो जो राइट वेंट्रिकल को क्या करना है, ब्लड डालना है पल्मनरी सर्कुलेशन में, तो ऑलरेडी पल्मनरी सर्कुलेशन जो है कंजेशन है वहाँ पे प्रेशर ज़्यादा है, तो उस ब्लड को राइट वेंट्रिकल से पल्मनरी कंजेशन में डालने के लिए और प्रेशर नीडेड होगा, तो इट विल इंक्रीज द वर्कलोड ऑफ द राइट वेंट्रिकल, ठीक है। दैट विल लीड टू द एनलार्जमेंट ऑफ राइट वेंट्रिकल एंड राइट वेंट्रिकल फेलियर में बी अकर. Then symptoms of corpulmonale are there will be shortness of breath or lightheadedness will be there during the activity. This is the first symptom which will be felt by the patient, and then over time symptoms with lighter activity or even while at the rest. पहले जब activities में होगा shortness of breath and lightheadedness, but later on as the disease progresses जो there will be shortness of breath at the time of rest also, and and these may include the fainting spells with the activity. जैसे एक्टिविटी करने लगेंगे तो the patient will get faint हो जाएगा. Then chest discomfort will be there, usually in the front of the chest, and chest pain will be there, and the swelling of the feet and ankles will be there because of the obstruction of the flow. Then symptoms of the underlying causes, that will be the respiratory symptoms, wheezing and coughing may be there. Then assessment and diagnostic evaluation. Firstly we will do the physical examination which will reveal the fluid buildup in the abdomen, ठीक है, and there will be abnormal heart sounds, and there will be cyanosis because of the hypoxemia, and liver swelling will be there. क्यों? क्योंकि pulmonary congestion is there, that because of that there will be congestion or overfilling of hepatopulmonary veins, so that will lead to liver swelling also. Then swelling of the neck veins, जो हमने पहले पढ़ा कि the jugular vein will be distended because of the pulmonary congestion, which is a sign of high right heart pressure, and then ankle swelling will be there. Then ankle swelling will be, these all things will come in the these all things will be seen in the physical examination, ठीक है. In the physical examination these things will be revealed. Then next is the blood antibody test, chest x-ray, CT scan of the chest, echocardiogram. These all imaging tests will be done for assessing the condition of the heart. The right side, the right sided hypertrophy will be seen over this, and then lung biopsy may be done, but this is rarely done if there is some major problem. Then and then measurement of blood oxygen by the arterial blood gas, that is ABG analysis will be done. Pulmonary function test will be done, in which different flow rates will be assessed क्योंकि the pulmonary functions are affected, ठीक है. Then right sided catheterization can be done to if there is some because to analyze the what to improve the blood flow, the right heart catheterization can be done. Then in this is a two right sided heart catheterization is done for the diagnostic purpose, that is to locate the obstruction, which is the reason of the obstruction of the flow in case of increased resistance. Okay. Then management, the goals of the management are to improve the patient's ventilation and to treat the underlying lung disease, because of which disease this condition has occurred, and we to treat the the manifestations which are because of the heart condition. Then treatment may include the anticoagulants can be given to reduce the risk of blood clots, that is blood thinners can be given. Then oxygen therapy to maintain the saturation of the blood, and then a lung or heart lung transplant if medications does not work in some patient. If the condition is very poor and the medications are not working, then we can go for the lung transport or heart lung transplant. Then supplemental oxygen can be given to improve the gas exchange, ABG analysis to monitor the effects of the oxygen therapy, and then chest physiotherapy can be given, for bronchodilators can be given to improve uh, the respiratory status of the patient, to improve the circulation of the patient. Then intubation and mechanical ventilation in case of respiratory failure. Then bed rest can be given to the patient, and sodium restriction as well as the diuretic therapy can be started. Digitalis to relieve the pulmonary hypertension, ECG monitoring to detect the dysrhythmias. मैंने ये सब ज़्यादा इसलिए नहीं एक्सप्लेन किया क्योंकि ऑलरेडी प्रीवियस क्लासेस में वी हैव डिस्कस दीज थिंग्स इन डिफरेंट कंडीशंस. ठीक है. Then nursing management, we have to assist in the intubation process and maintain the mechanical ventilation of the patient, and then assessment of respiratory and cardiac status of the patient has to be done regularly. Then teaching about the importance of close monitoring and adherence to therapeutic regimen. This teaching can be given to the patient as well as the family, that how they should monitor the changes or the signs of any problem. Then the importance of adherence to the therapeutic regimen, उनको explain करना है कि आपने बीच में treatment नहीं छोड़ना और जैसे treatment बोला गया वैसे ही लेना है. Then counseling regarding diet can be given to the patient. Thank you.